Sameera is an occupational therapist and the manager at Multicultural Health Connect. Delivered by World Wellness Group in partnership with Healthdirect Australia, this telephone health information and advice line is for people from multicultural backgrounds. The line is culturally responsive to help break down access barriers to services and empower people in gaining increased independence in managing and understanding their health and the health system in Australia. Sameera is also a co-director at the SocioHealth Lab at the University of Queensland. So thank you, Sameera.
Hi, everyone. How are you today? I'm just going to get my slides up. Okay, just checking that everyone can see that.
Can't see anything yet.
Okay. Give me a second. All right, how's that?
I think it's coming. It says that you've started screen sharing.
Okay.
But it's not quite here yet. I wonder why it's taking so long. There we go. Now I think you just need to do the switch the settings, the display settings, because we see the speaker notes.
I think if you click on the fourth button from the left.
Okay, I'm having an error come up, say Zoom quit unexpectedly.
I can share it for you on your behalf. I have access to your slides.
I might just try again. It's sometimes easier to do your own slides. Okay. How's that?
Still coming.
Okay. All right, Mahima, I might need.
Okay, no dramas. I'll do that now. Yeah, could you stop your share, please? And then. Thank you. Yeah, if you want to prompt me when you're ready for the next slide, I can just move it along.
Thanks. So can everyone hear me and see me? It looks like I got kicked off Zoom and I'm back in now.
Yep, we can hear and see you.
Thanks. So I just want to start off by thanking everyone for having me here today. It's amazing to hear everyone's presentations. My presentation is going to be a little bit more practical, perhaps not as academic, because I'm really talking through some of the learnings and experiences we've had here on the ground delivering some telehealth services. So I hope this tweaks your interest, and I'm always happy to chat. So I'll leave my contact details at the end of the presentation. So I just want to start off with acknowledging the traditional owners of the land on which I am on, which is the Yagara and Turrbal people. We understand that the connection between this land and its Indigenous people has been special and has a spiritual significance that benefits the social and emotional well-being of us all. We pay our respects to elders past, present, and future of this ancient land and recognise that delivering equitable healthcare requires that we understand, appreciate, and reflect on our respect for both Aboriginal and Torres Strait Islander peoples. We commit to growing and nurturing our relationships with Indigenous Australians to assure we have their rightful place in this journey and we have better outcomes as a result for all Australians. Thanks. Next slide. So who we are here at World Wellness Group. We're based in Brisbane, in Stones Corner, and we are a leading social enterprise and multicultural health charity. So we were founded in 2011 by 5 healthcare workers, and the mission of our service is to provide health equity by delivering health and wellness services in the system while working on the system. So we're really about impacting and creating systems change. So we aim for our services to be accessible and equitable to people of all backgrounds, particularly people from multicultural backgrounds, refugees, migrants, asylum seekers, and people on temporary visas as well. So after 10 years of work, we have just celebrated our 10th birthday, which we're really proud of because we know not many social enterprise health charities make it this far. So we're really excited about the work that we do and the future that is ahead. So I'm going to be talking a bit about our telehealth services. So we're going back to a long time ago at the start of the pandemic. So at World Wellness Group, we're mainly a primary healthcare service. So we have a GP, allied health, natural therapies, and we have mental health services as well that are both funded by Queensland Health and the Commonwealth Department of Health via the primary health networks. And we offer a range of services. So during the pandemic in 2020, what we found was that there was a huge demand on the support of our admin staff and also a 200% increase in demand for our mental health services. So I'll go to the next slide. If you remember back in March 2020, it feels like a long time ago, but we all went into lockdown and these were some of the scenes that we observed. For a lot of us, sorry, go back, yeah. For a lot of us, we were able to get messages and communications via television, news, the state and federal Department of Health websites. But what we really saw was that the people from migrant, refugee and asylum seeker backgrounds who didn't have access to English media didn't get the messaging the same way as the mainstream Australian population. So a lot of people were getting information from friends, family and social media from overseas. And people were therefore lacking some of the localized context around COVID messaging. And what we saw was that at the start of the pandemic, people were really clear on what was required. So when we went into lockdown, it was about staying at home, hygiene messages, social distancing. However, once we started to open up and restrictions changed and messaging became more nuanced, it was more challenging for people from non-English speaking backgrounds to access that information. So what we did is we did a series of check-ins with our clients of our clinic, and what we found is there were definitely access barriers in terms of information and access to appropriate health information and health services. And that has sort of been an ongoing trend. So from the slide that you can see here, almost 60% of deaths from COVID up to March 2020 were Australians who were born overseas. And you can see that's twice the share of the population. So with people from, people born in countries other than Australia representing around 29.15% of the population. So this issue around access to care, access to information and support in a timely manner has persisted through the pandemic. You can go to the next slide. And of particular significance is you can see here when we adjust for differences in age, people born in the Middle East actually had the highest death rate of COVID. So these are adjusted statistics here. And we were really keen on exploring what can we do to address some of these issues around access to information for people. So what we did is, we'll go to the next slide, Mahima, is we channeled some of that traffic from our mental health services and our admin staff in the GP clinic into a helpline. So this helpline was funded via COVID immediate support measures via Queensland Health, and that money came from public health and mental health funding. So we set up a psychosocial support line that was targeted at people from multicultural backgrounds, any visa type, any level of English language proficiency, And what we found was that a lot of the work we needed to do was with people who were really impacted by some of the psychosocial impacts of the pandemic. So job loss, housing insecurity, and deteriorating mental health as a result of social isolation and the emotional stress of the lived experience of that lockdown period and international students losing their jobs and things like that. So we like to refer to our helpline as a bit of an accidental helpline because it was really a response to what was happening in our local community. And we were able to have the support of the State Department of Health in Queensland to set up this helpline. And what we found it was only supposed to be there for 6 months, but what we found is that there was such a huge demand for support, and we were able to really advocate and explain our narrative backed up by data to get sustainability for continuation of the service. So we have funding now for this helpline until mid-2023 at this stage. So in terms of the design thinking, co-design, setting up the Multicultural Connect line was actually a very sort of quick process that we had to kind of step up in a bit of a hurry. And in response to a need that we could actually see in the community. So this is some of our marketing collateral that we used. It's a service that's open Monday to Friday, 9 till 4:30. And when we started talking to people about what are the issues for you in terms of your need, many people talked about, not having enough access to basics like food, employment, and then those things were sort of the precipitating factors for some of the mental health issues that people were experiencing. So you can switch to the next slide. So here you can see when we talked to people, most people were getting information from local sources. However, a big chunk of people, 43%, were getting their information about COVID and the pandemic from international sources. So we can see that there has been an issue around messaging in Australia around COVID and healthcare services. The next slide, please. So in response to all of these challenges in our local community, we set up this line. So as I mentioned, it's Queensland Health funded. We set up a 1300 number to provide a pathway and a navigation support system for people. So it was really about providing immediate support and some brief intervention to help people understand what they need to do in terms of managing the COVID pandemic, and then also managing day-to-day life impacts as a result of that. What we did is we worked with some key communities because some of the data that we had access to at the early stages of the pandemic indicated that there may be some target population groups that could benefit from this support. So we focused on working with Pacifica communities, various Asian communities, Muslim communities, and then we also set up a group around supporting people who have limited support. So what we're thinking of there is people from multicultural backgrounds in rural areas, on temporary visas, international students, and asylum seekers. So those are the people who historically and currently still have real challenging access barriers when it comes to engaging in support. We also have a team of bicultural workers here at World Wellness Group who we refer to as multicultural peer support workers. And we work together with them to do in-reach into community to really build trust and build relationships with community members in order for them to feel safe to access the service. So next slide. To set up the line, we needed to have the technology set up. We needed to have accurate and appropriate messaging. We needed a framework of support. We couldn't do this by ourselves, and we needed to think about sustainability, because as soon as we opened the line, we started to get very busy. So the next slide kind of shows you a little bit about where we've started. So we started with these, these snazzy looking telephones, and we set up this 1300 line, but with limited budget, this is what we could do, but it worked well. And we've managed to now move to having a little app on our computer, a soft phone, and some wireless headsets. So now we're feeling very technologically savvy on our Multicultural Connect line. The other thing we had to do is really focus on messaging. And for me, this was the first time that I actually did a translation project. And this was the English flyer. We thought that we'd written it in a way that was very easy to translate. However, going through a process with a translation company, it took a lot of time and a lot of money. And when we got the translations back, we were actually really shocked, because some of the language in the flyers was completely taken out of context. So what we had to do then is adopt a new process for doing our translations. And I think this is a really important learning for the entire sector. And the key thing here is that you need to have community consultation as part of your translation process. So we pivoted, we changed strategy, and what we did was we once again engaged our multicultural peer support workers, and we did our own translation of the flyer. And then we contacted translators from the NAATI website. So NAATI is the accrediting agency for translators. And we asked the translators to work with us to co-create the translation until it got to a spot where it was accurate in terms of the language, tone, and context. So it really spoke to community. And what we found was that this was actually a lot cheaper, and it was a lot faster than going through a translating company. We tried all sorts of things around marketing, including different social media tiles targeted at different community groups in Queensland. And we were really excited. We also had some billboards up around Queensland about our service. Obviously, billboards can be very expensive, but because we are a charity, there are options with some marketing companies to have heavily discounted advertising. So we used a range of strategies to get the word out there to people, but pop to the next slide. The key thing was that we used a very data-driven approach and our own knowledge of the communities that we support already to be able to inform where we needed to go with our marketing. And this is an example of some of the work we did with Risk Insights to develop a bit of a dashboard around understanding where our multicultural population is situated in Queensland. And we used the data and our knowledge of community to really target our marketing campaign. And it was very successful because our call numbers just started to really build. A key element of that marketing was that we needed to be responsive to what was happening in the community. So if you switch to the next slide, you can see some of our Facebook marketing. So what happened is after the initial few months of funding, we became a fully mental health funded service, and we had to kind of pivot into providing more psychosocial support rather than COVID public health response. And we had to change our messaging to be one that's more around supporting people with the mental health impacts of COVID. And a key thing is that we wanted to remain a non-stigmatized pathway into mental health support for people. So the language we use is really important. So instead of saying, is your mental health impacted by the COVID pandemic? We would use language such as, are you feeling worried or confused about the latest COVID situation in Queensland? You're not alone, give us a call. Okay, so what we really try to emphasize in our service is that it is a service that is open to anyone and everyone needing any kind of support. So it's really about providing practical support. And what we know is that people from multicultural communities are more likely to access practical supports. And once they've built a relationship with someone, we're then able to start the conversation around how are you feeling? How's your emotional health? What's your well-being like? And then support people to understand the value of some mental health support that's culturally tailored. So Multicultural Connect line really acts as a front door to support services, be they mental health, health supports, or social and community supports. Another key element of the service design was that we needed to remain flexible and responsive to community need. So an example of that is now we have started doing some work. Sorry, can we go back to the last slide? Doing some work with community recovery in Queensland in response to the floods. So many of the suburbs that were impacted by the flooding have a high multicultural population. So we're able to sort of pivot and start to respond to some of those needs in the multicultural community in terms of flood recovery. And that will be, I think, via the support of the PHN, the Primary Health Network, which is Commonwealth funded. And our framework is really to offer assessment, triage, referral, and direct support to people via brief intervention. So we give those pathways to people for face-to-face support, and for people who are able and confident and comfortable to have support over the phone, we can provide that too. So a strong recommendation that I would have in terms of setting up telehealth services for people from multicultural backgrounds is to stay away from a scripted approach to service delivery and instead have strong principles around what you want to do in your telehealth service and train staff to be able to meet people where they're at and have a conversation about what you can do and what you can't do and where people can go for that support. And it's also really important when you're in a telehealth service to have a privacy and confidentiality messaging that really speaks to your audience rather than a message that is perhaps quite clunky and long and confusing, because you want to have informed consent from people. So next slide. Obviously, because of our design and our flexibility and agility, we are not a typical helpline at Multicultural Health Connect. Basically, 1/3 of our callers had 5 or more presenting issues. 1 in 10 callers have had more than 10 callbacks. So that's the brief intervention work. And international students actually represented 25% of our work through the pandemic. Okay. I'll skip the next slide. So I've sort of talked through that process of translation. These are some examples of issues that people have had understanding government COVID information. So this example here, you can see the Arabic translation didn't make any sense at all because of the formatting. And then if you have a look at the second example there, it was meant to say information in your language. However, what it actually said was use your language supplied information. So it's a little bit like, I don't know if any of you have ever had to just use Google Translate to understand something, but it's that kind of experience that when translation is done without the context, tone, and community checking, you can end up with very confusing messages. So I really recommend taking that community design approach on board. So our key learnings from the Multicultural Connect line, which is our Queensland service, is that we need to remain needs-based and non-stigmatizing. So language is very important. We have had a mix of culturally competent, multilingual, and different allied health staff on the line that were able to sort of adjust their way of engagement to meet the needs of the people that they were talking to. Easy access to language support is essential, and you need a very clear entry point, one touch kind of contact point for people. In order to promote your service and to get service usage, it is critical to have a grassroots approach to community engagement. And it's really important to involve community in your co-design, testing, translations, and promotions as well. What you will find is when you set up services for multicultural populations, you'll get referrals that fall outside the scope of your service. So make sure that you've got referral pathways that can meet people's needs outside of what you can do. We found that temporary residents obviously were most impacted by the pandemic, and it's really important to understand the geographical region in which you're working to know what's working and what needs to improve. So I'm going to skip through a little bit of the next slides and go to sort of some of the things to consider. Yes, this one here. So where to next? Basically, from the Multicultural Connect line in Queensland, we set up a COVID in the home service as well. So we have a number that people can call if they've got COVID. And through this whole experience of setting up Multicultural Connect line, we were contacted by the Department of Health and Healthdirect Australia, and we have worked together to co-design our newest service, which I am now managing, and we have just gone live in Victoria. So the service is called Multicultural Health Connect. You can pop to the next slide. And we are here to act as a wraparound service and a pathway to the Nurse on Call service in Victoria for people from multicultural backgrounds. You can scan our QR code and save our website there. And what we do is, once again, we have a diverse team of people working on the lines, and we call them telephone health service navigators. And what they do is they work with people to address their health needs by either providing some system navigation support, answering COVID questions, and also supporting people link in with the Nurse on Call service and building health literacy around that engagement. So what I really want to wrap up with is some key things that you need to consider when working with multicultural communities within a mainstream health service. Is that, number one, the Australian health system is generally quite fragmented and tricky to understand. When you're setting up a service, you need good governance and a good solid ecosystem of support. So you need to be working with funders that understand the needs of you as a service and your expertise in delivering services to multicultural communities. And funders need to be at a level of maturity that they're able to understand that they're going to need to do things differently in this space. It's really about the motivation, innovation, and ability to have some autonomy in the work that you do to respond to community need. So yes, it's challenging. It's very challenging work, but we're getting there and we're doing it.
A huge challenge and a really innovative and practical and useful solution. So thank you so much, Sameera.